In Humsalaba village in Kakamega County, the funeral service of Dr. Daniel Alushala is on. KMPDU Secretary General Mwachonda Chibanzi, who attended the funeral, says health workers are taking a lot of hits from the virus during the second wave.
Leo asubuhi peke yake, kulala kuamka asubuhi tunapoteza madaktari wawili. Na jana tulipoteza mmoja. Kwa hiyo ni watatu ndani ya masaa 24.
Friends and relatives of the late Mohammed Hatimi in a procession to pay him the last respects. The ward representative succumbed to COVID-19. The situation has the county governor on edge, and he is telling Mombasa locals of the danger that lurks.
Few are careless in a situation where last week in Coast General alone we had 38 or so positive health workers. Why did they become positive? Because they looked after you. They looked after us. We lost a nurse.
The outspoken member of the county assembly and ODM Mombasa County chairman was among 7 MCAs who tested positive, leading to temporary closure of the assembly on the 27th of October. He had been admitted to the Mombasa Hospital intensive care unit. Hatimi joins a growing list of fatalities due to COVID-19. The crisis is silently deepening. At the Kenyatta University Referral Hospital, sources told Citizen TV that at least 40 patients have been turned away in a space of 2 days as shortage of health workers hits the facility. At least 30 doctors and nurses have succumbed to the virus countrywide.
Viongozi wetu wanapopatikana na ugonjwa kidogo hata wa kukohoa tunaona wakichukua ndege wanaenda kutibiwa nchi za nje. Sisi wa Kenya na sisi wauguzi ama sisi wahudumu wa afya katika nchi hii hatutakubali kugandamizwa, na hivi karibuni ikiwa serikali haitabadilisha msimamo wao huenda tukaona maafa mengi katika nchi yetu ya Kenya.
We are not safe. We are casting aspersions even to what my colleague has said, to the quality of the masks and even the PPEs which are being produced even locally.
Dr. Victor Njom, the Kenyatta University Hospital Chief Executive Officer, declined knowledge of goings-on in the hospital, saying management is still holding talks. KMPDU Nairobi Secretary General Dr. Thuranira Kaugiria has called on government to provide a comprehensive cover, including treatment of COVID-19 to all health workers and establishment of a hospital dedicated at treating health workers during the pandemic. In the last 24 hours, the country has recorded 1,008 new infections from a sample size of 8,322. This represents a positivity rate of 12.9%. At the same time, 21 patients have succumbed to the disease, raising the death toll to 1,249.
We have taken this pandemic as very casual. It is going out of hand, and we know that how many people are dying every single day. We also know how dangerous it is, but we have taken it such easy that we meet people, we go to the temples and meet do the gathering. We go to the restaurants, we go to hotels, we go to the Karoga place, we go to many other places as if there is nothing in the country.
542 COVID-19 patients have recovered. 262 were under home-based care program, while 280 have been discharged from various hospitals. An additional 1,185 patients are still admitted in various facilities countrywide, with 58 in intensive care units. Elfas Lagat, Citizen TV, Nairobi.